How to take orthostatic blood pressure. Orthostatic blood pressure is a vital sign gathered from a patient who has potential blood pressure problems. Something called orthostatic hypotension occurs when a person's blood pressure drops considerably when transitioning positions, going from lying down to sitting up, sitting to standing, etc., and results in a feeling of lightheadedness and dizziness, even fainting. Specifically, if the systolic blood pressure, the higher number, drops by 20 units upon standing, or the diastolic blood pressure, the lower number, drops by 10 units upon or within 3 minutes of standing, the person is said to have orthostatic hypotension. You can measure a person's blood pressure in different positions in order to determine whether or not they have orthostatic hypotension. Measuring blood pressure lying down. Ask the person to lie down for 5 minutes. He should be completely flat on a table, bed, or couch. Wrap the sphygmomanometer, or blood pressure gauge, armband firmly around the person's upper right arm and secure it with the Velcro strip. Place your stethoscope over the brachial artery. With the blood pressure cuff wrapped around the person's arm, have her palm facing upwards and place the stethoscope on the inside of the elbow. The stethoscope has a large surface area, so placing it on the inside surface of the elbow should ensure that it covers the brachial artery, which travels through that area. You will be listening to sounds in the brachial artery as your way to measure blood pressure. Inflate the armband with the pump. Generally, you should inflate it to around 200 as your starting number, and gradually deflate it from there. As the cuff deflates, look for the systolic blood pressure reading. Systolic blood pressure is the force of the blood pumping through the arteries, and it is usually between 110 and 140. You will recognize the reading for the systolic blood pressure at the moment you begin to hear the thump sounds in your stethoscope. This is the sound of blood flowing through the brachial artery. Keep note of this number in your head as you continue listening while the cuff deflates. Record the diastolic reading after the sound clears. This number should be lower, usually between 60 and 90. It is the pressure on the arteries between heartbeats. Write the systolic blood pressure number, and then the diastolic blood pressure number. Both are measured in millimeters of mercury, or mmHg. For example, you might write 120/70ths of a millimeter Hg. Finish by taking the radial pulse reading. This is the pulse you find by placing your index and middle finger over the inside right wrist. When you feel the patient's pulse, watch your clock or watch for exactly 60 seconds and count the beats. Most people have a pulse between 60 and 100 beats per minute (BPM). If the patient's pulse is above this, he may not be able to stand and continue the test. Write down the pulse or heart rate, and then prepare yourself for the next portions of the test where you will ask the person to stand.